Hi, welcome to today's episode of my pregnancy journey with Dr. Sikolia. In this episode, we shall be talking about ectopic pregnancy, what it means, and how it affects your health. So an ectopic pregnancy is any pregnancy that is occurring outside the lining of the womb. So normally what will happen is that when you get pregnant, the fertilized egg should travel into the womb and then implant there, and that's where it grows and becomes big. So that is a normal pregnancy. If that doesn't happen, then it means that the fertilized egg could implant anywhere else within the tummy. So it could be in the tubes, which is the one we see most commonly. It could implant in the ovaries, it could implant even in the intestine. So it is any pregnancy that is not in the right place. So the reason why ectopic pregnancy happens is that there is a delay in the fertilized egg traveling into the womb. So that takes time. Usually it is programmed that by the 6th day after fertilization, the egg should have reached the womb, and that is where it sticks and implants and starts growing. So if that time expires and the egg has not found its way to the womb, then it could grow wherever it is. So it is that slowness of the fertilized egg of finding its way into the womb that will cause an ectopic pregnancy. There are several risk factors that could expose a woman to ectopic pregnancy. So any woman who's pregnant is at risk, but the risk is more in women who've had surgery on their tubes or within the abdomen, women who've had infections, especially the pelvic infections like the sexually transmitted infection. It's also common in people who are using some forms of contraception. For instance, we see it commonly with frequent use of the emergency pill. If you have a coil, you are at more at risk of getting an ectopic pregnancy than someone who doesn't have it. And then we also see it with patients who have disorders of their organs. So the tube has a disorder, which then makes you more prone to getting an ectopic pregnancy. Symptoms, usually, the three things that must be present. So you must test pregnant, so your pregnancy test is positive. Then it starts off with very severe abdominal pain. So you have pains in the lower tummy, which usually is very sharp and quite severe. And then sometimes, but not always, you would also experience bleeding, like period-like bleeding when you're expectant. So those are the three things that must be present for us to suspect an ectopic pregnancy. Then in the extremes of cases where it has already advanced, and we shall be talking about this later, patients will actually present in shock when the tube or the ectopic pregnancy has ruptured and they have lost a lot of blood within the tummy. Any person who's pregnant, any woman who's pregnant and has sharp pain in the lower tummy should actually be checked, because that could just be the first sign that you may be having an ectopic. So the key to diagnosis is to have an ultrasound done. And at that stage in pregnancy, since most ectopics would actually happen in very early pregnancy, then you will require the scan to be done through the transvaginal route, that is from down below, so that we can be able to see the womb clearly and be able to see where the pregnancy is. Treatment of ectopic depends on when it's discovered. So if it is discovered early, when it has not complicated yet, and if it's still very small and without severe symptoms and the patient is stable, then you could benefit from medical treatment. And this is through an injection that we give you that would then dissolve that pregnancy and disappears with time. However, if you come in late, if the pregnancy has already advanced, or maybe the ectopic pregnancy has passed, then the best way to go about it is to do surgery. And so surgery is done in two ways. The standard now is to do it through the minimal invasive, that is a laparoscopy. And when we are in there, we either remove the ectopic, the pregnancy itself, and leave the tube or the other organ where it is, or we may have to remove the whole tube if it is damaged, or the ovary, or whatever part the pregnancy is attached to. So either medical or surgical. There's few circumstances where we do nothing and just observe, and this is in cases where the pregnancy was very early and it died off and is not posing any danger to the woman. So in that case, we can actually just observe the woman and then review them on a regular basis until the pregnancy disappears on its own. So ectopic pregnancy is actually a medical emergency in most cases, because most patients will present when the tube or the sac itself has already burst and they have lost a lot of blood within the tummy. Some may be in shock, and some may have lost so much blood that the other organs are affected. So yes, it's most of the time it will be a medical emergency which will require very urgent surgery. So my advice would be for any woman who's pregnant to try as much as possible to do a scan quite early in their pregnancy. This I'm talking about 6 weeks thereabout, so that we know where the pregnancy is located. If it is an ectopic at that particular point, then you could benefit from medical treatment and avoid surgery. So I really would emphasize that women should have scans early in pregnancy to locate where the pregnancy is. Thank you very much for watching this episode on ectopic pregnancy. We hope you found it informative, and if you liked it, please remember to share, like, and subscribe to our videos.